Hello and welcome to the refresher training session on reviewing the surveillance definition change for up-to-date vaccination status for long-term care facilities. My name is Sharice Denard, and I work with the Division of Healthcare Quality Promotion at CDC. Before we begin, as a general reminder, please contact CMS with questions about reporting requirements using the email addresses provided on this slide. The objectives for today's webinar is to review the up-to-date definition change, as this definition applies to weeks beginning on September 26th through October 2nd, 2022. We will then review example scenarios and discuss frequently asked questions. Please note that the slides from today's session, as Jonathan mentioned, will be posted to the NHSN COVID-19 vaccination website in the coming weeks. Throughout this presentation, we will be reviewing this definition as it applies to the COVID-19 vaccination modules. As you know, the definition of up-to-date may change over time for NHSN surveillance to incorporate changes made to the clinical guidelines and recommendations. Therefore, facilities should refer to the definition on the first day of the reporting quarter. Although long-term care facilities report data weekly, facilities should use the definitions outlined in the document linked on this slide for each quarter. Facilities should review this document at least once per quarter to check for definition changes. The guidelines were updated September 26, 2022, which is the focus of today's webinar. Now, let's begin reviewing the up-to-date definition for COVID-19 vaccination for the current quarter. The image on this slide shows the question on up-to-date COVID-19 vaccination status for the COVID-19 vaccination modules for each quarter. Facilities should report the cumulative number of individuals who are up to date with COVID-19 vaccines for question number 5. Beginning the week of September 26, 2022 through October 2nd, 2022, the definition of up-to-date is based on receiving an updated bivalent booster dose. So who's considered up-to-date with COVID-19 vaccination at this time, which is, again, quarter 4, 2022. The dates are September 26th through December 25th, 2022. The answer is an individual who has received an updated bivalent booster is considered up to date with COVID-19 vaccination at this time, which again, let me repeat, is quarter 4, September 26, 2022 through December 25th, 2022. Please note that most individuals should only be counted as up to date if they have received their updated bivalent booster dose. Beginning September 26, 2022, most individuals should only be counted as up to date if they received an updated bivalent booster dose. Now, what this means is that most individuals who have not yet received an updated bivalent booster are no longer considered up to date with COVID-19 vaccines and should not be counted in question number 5. Here's a question here, and it says, it's a question that we get quite a bit. If I realize I reported the incorrect number of individuals who are up to date for past weeks, what should I do? Now, if you realize that you categorized individuals as up to date incorrectly for question number 5 during quarter 4 of 2022, please adjust your recent weekly counts for question number 5. So that you are reporting an accurate number of individuals who are up to date. NHSN always encourages retrospective submission and updates.
Hey everyone, my name is Molly Stillions, and I am going to just discuss how this affects the RIFC form, so Resident Impact and Facility Capacity Pathway, which is part of the COVID-19 surveillance pathways. So that will include RIFC, staff, and therapeutics. So there's 3 pathways underneath COVID-19 surveillance pathways, and the RIFC pathway is one of those. And within the RIFC pathway, we do collect some vaccination status information. So the resident impact and facility capacity pathway, again, also known as RIFC, that's how we'll refer to it, collects counts for residents with a newly positive SARS-CoV-2 viral test result. And of the residents that have been included in the positive test count for the reporting week, this pathway will also collect vaccination status for those individuals. So this pathway is reporting positive test counts for residents, COVID-19, positive COVID-19 tests for residents. And then of those residents who are positive, you then will report vaccination status. So if you have reported residents with a newly positive COVID-19 viral test on the RIFC form within that pathway and classify these individuals as up to date, but they are not actually up to date, please correct the counts you have previously submitted for the up to date category. So just go in to that pathway and revise the count entered for up to date, and be sure to include that resident in the appropriate vaccination status category. So I also want to make a note here. You do not need to revise the positive test count, only adjust the up-to-date category and update counts for the correct vaccination status category as applicable.
Before we review the specifics of the up-to-date definition, let's review some key terms surrounding COVID-19 vaccination. First, we will define primary COVID-19 vaccine series. Completing a primary vaccine series means receiving a 2-dose series of a COVID-19 vaccine, Pfizer, Moderna, and Novavax, or a single dose of Janssen COVID-19 vaccine. We will now discuss the difference between booster dose and additional dose. A booster dose is another dose of vaccine administered after receiving a primary vaccine series to enhance or restore protection which might have subsided over time. Whereas an additional dose is another dose of vaccine administered to people who were less likely to mount a protective immune response after initial vaccination. People who are moderately or severely immunocompromised should receive an additional dose. Now we will go over an important point about data reporting. If an individual was administered 1 or 2 doses of COVID-19 vaccine after they completed their primary series, with no further details provided, then for the purpose of NHSN surveillance, assume these doses are boosters and not additional doses, unless you have specific documentation indicating that there are additional doses administered due to the individual having a moderately to severely immunocompromising condition. We will now discuss what an updated or bivalent booster is. An updated booster is a booster that targets the most recent Omicron subvariants in addition to the original variants. As a reminder, beginning the week of September 26, 2022 through October 2nd, 2022, the definition of up-to-date is based on receiving an updated bivalent booster dose. Let's review a few examples of how to report up-to-date COVID-19 vaccination status. As a reminder, beginning September 26, 2022, most individuals should only be counted as up-to-date if they received an updated bivalent booster dose. We will now walk through an example of reporting up-to-date vaccination status. This slide shows how up-to-date COVID-19 vaccination data are entered into NHSN. In the example, there are 40 residents in the facility, and 30 of these residents have completed their primary vaccination series. Among these 30 residents with completed primary series, 26 are reported to be up to date with COVID-19 vaccines. The 26 residents are reported to be up to date with COVID-19 vaccines for question number 5. And as a reminder, again, beginning the week of September 26, 2022 through October 2nd, 2022, the definition of up-to-date is based on receiving an updated bivalent booster dose. Now we will go over some examples. In the first example, we will use the name Mary. Mary received a bivalent booster in October 2022. Therefore, she is considered up to date. If reporting data for any week after September 26, 2022, your facility would count Mary as part of the weekly total of individuals who are up to date with COVID-19 vaccination for question number 5. In example number 2, we will use the name Tom. Tom received 2 doses of Pfizer vaccine and 1 dose of the original monovalent Moderna vaccine as a booster. He also received a bivalent booster dose 2 months ago. Is Tom up to date? The answer is yes. Tom is up to date with COVID-19 vaccines because he received an updated bivalent booster dose. Here's another example. Sandy received 2 doses of Pfizer vaccine and an original booster dose 2.5 months ago. Is Sandy up to date? The answer is no. Sandy is not up to date because her most recent original monovalent booster dose was over 2 months ago, and she has not received an updated bivalent booster dose. The next 2 examples are examples to show that if an individual is eligible to receive a bivalent booster but has not received it, he or she is not considered up to date with COVID-19 vaccination. In the example, Tom is not considered up to date because he has not received an updated bivalent booster, even though he is eligible to receive it. Please note, if individuals are eligible but have not received the bivalent booster vaccine for any reason, even if they are recommended to delay receipt of the bivalent booster based on interim clinical considerations, do not count them as up to date for NHSN surveillance. Here's another example for an individual who is not considered up to date. Molly completed her primary vaccination series plus her monovalent booster dose in July and is eligible to receive an updated bivalent booster dose, but has not done so. Is Molly up to date? Molly is not up to date because she has not received an updated bivalent booster dose, although she is eligible. If reporting data for any week after September 26, 2022, your facility would only count Molly as having completed her primary COVID-19 vaccination series for question 2.2. She would not be counted as up to date, which is question number 5, because she has not received an updated bivalent booster dose. Let's now review some frequently asked questions, or FAQs.
Okay, so let's switch gears just again here to go over the RIFC pathway. So this is resident impact and facility capacity pathway, part of the COVID-19 surveillance pathways. So the question here is, how do I categorize a resident with a newly positive SARS-CoV-2 viral test result who received a completed primary COVID-19 vaccine series, 1 original booster dose, and an updated bivalent booster dose? So for this specific resident, they would be included in the complete primary vaccination series category, as well as the additional or booster vaccination category. And then they would be counted in 2 or more boosters because they had 1 original booster dose and an updated bivalent booster dose. And they would also be included in the up-to-date count. And I believe the next slide will show us a screenshot of how to report this. Yes, so this is a screenshot of the RIFC pathway. And for this specific example, we've had 1 positive test this week. And this resident did complete their primary vaccination series, so they are counted in that category. And then they did receive an additional or booster dose, so we've counted them there as well. And then as far as the subset, asking if it was one booster or two or more boosters, we've included them in the two or more booster category, since they did receive that original booster dose and then the bivalent. So they have gotten two or more boosters. And because they have gotten that updated bivalent booster dose, then they are also counted in the up-to-date category. So this is what it would look like for that specific example, especially if you only had that one positive test for the week. So this is what it would look like.
Thank you, Molly. For question number 3, an individual received a complete primary COVID-19 vaccine series of Pfizer 5 months ago, but did not receive any booster doses. This individual is not considered up to date because they have not received a booster dose, despite being eligible to receive an updated bivalent booster dose. This individual would be counted in question 2.2. However, they would not be counted in question 4 as having received any booster or additional doses. In the next question, a resident received a completed primary COVID-19 vaccine series and one original booster dose, plus a bivalent booster dose. This person is considered up to date because they received an updated bivalent booster dose. They will be counted in question 2.2, 4, 4.2, and question 5. The next questions ask, how do I categorize a resident who received a completed primary COVID-19 vaccine series of Pfizer, and 2 original monovalent booster doses, with the most recent booster dose being 2.5 months ago? They will be included in question 2.2 and questions 4 and 4.2. This person is not up to date because they received their last original monovalent booster dose 2.5 months ago, so they are eligible for an updated bivalent booster dose. The next question is the current quarter, which is quarter 4, up-to-date definition the same for those who are under 50 years of age and those who are 50 years of age and older? The answer is yes. Beginning quarter 4 reporting period, which begins the week of September 26, 2022, the definition is the same for those who are under 50 years of age and those 50 years of age and older. Users who submit weekly vaccination data with the person-level vaccination forms have the correct up-to-date definition automatically applied when submitting data for each reporting week. If you are interested in getting started with using the person-level vaccination forms, please see our resources on the NHSN Long-Term Care Vaccination website. Now let's review a few important key points about the updated bivalent booster dose. Earlier in the month, an email blast was sent with this reminder. Please note that beginning September 26, 2022, most individuals should only be counted as up to date if they received an updated bivalent booster dose. This means that most individuals who have not yet received an updated bivalent booster are no longer considered up to date with COVID-19 vaccines and should not be counted in question number 5. Please adjust recent weekly counts on vaccination forms and RIFC forms if you reported an incorrect number of individuals who are up to date. We will now review how to access the additional resources that are available to facilities. Several resources are available for reporting up-to-date COVID-19 vaccination data for long-term care facilities. The links on this slide will take you directly to the resources. The long-term care vaccination component website contains links to a variety of training materials, including quick reference guides, training slides, TOIs, and information on CSV upload. The TOI is a great resource to use while entering weekly data for the COVID-19 vaccination modules. The long-term care COVID-19 module web page also contains a variety of resources, including data collection forms, TOIs, training slides, and information on CSV upload. The TOI, again, is a great resource to use while entering data for the COVID-19 surveillance pathways. This document will walk you through how to report data for each pathway. If you have any questions about NHSN, please send an email to user support at nhsn@cdc.gov. Please include weekly COVID-19 vaccination in the subject line of the email along with your facility type. Please note that when you are emailing user support, the text that you enter into the subject line is very important with getting the ticket expedited to the appropriate group. This concludes the presentation. Thank you so much for your time.